Hey guys, it's Dr. Thornell, and I wanted to talk to you today about the effects of carrying excess belly weight. Number one, when we carry excess weight on the body, and not just belly weight, but when we carry excess weight, what it does to the spine is it causes more compression on the spine itself. If you picture your spine as your finger, if I put 10 pounds of pressure on that finger for 5 minutes, it's no big deal. But if I put that same 10 pounds of pressure on those joints all day long, every day, what do you think the effect is going to be on those knuckles? How comfortable are you going to be using that finger after hours of pressure on that joint or those joints? It's not going to feel very good. And the reason it's not going to feel very good is because they're not meant to be overloaded with pressure constantly. And when we carry excess weight on our body, our spine constantly gets compressed like that. And that alone will wear out the joints prematurely. They'll become arthritic. We'll have disc injuries. Just simply carrying excess weight just over the compression is something that's going to cause deterioration within the spine and ultimately arthritis and breakdown. But what we're going to talk about more specifically is belly weight. When we take a normal posture like you see on the wall here, and all of a sudden we take this belly and we grow it like this, through pregnancy would be one, and everybody knows that pregnant women tend to experience lower back pain, but also through drinking beer and eating bad food, we get this great big belly. And the problem with this is that great big belly, as it pulls us forward, we have to counterbalance for that. If I get this great big belly out in front and I don't counterbalance, it's going to pull me forward all the time. So what happens within the body is we counterbalance by leaning back further. And inside the spine, as that belly, which would be here, gets big and I counterbalance backwards, we actually have an overextension of the joints in the lower back. And if you look closely here, we can see the back side of those joints. And again, if you picture that finger example that I gave you earlier, if I put all that chronic compression on those joints and now I extend them, it would be like taking that finger and not only putting pressure on it like this, it would be like bending it backwards and now giving it that compression all day long. It's no wonder that we're going to have pain in those joints. And you come in and you go, "Hey doc, I've got pain in my lower back, can you fix it?" An adjustment is temporarily going to make that feel better, but think about the finger. If we take that finger and we adjust it, we pop it, crack it, move it around, it's going to feel better temporarily. But if I go right back to doing this, have we really done anything to help that finger? Not a whole lot. What we've done is we've temporarily and symptomatically made it feel better, but we never addressed the problem, which is me compressing and extending that finger. I can't do that all the time, and that pain is your body's way of saying, I can't take this anymore. So if you're carrying excess belly weight, then those joints on the backside are getting compressed constantly, and there's not a whole lot we can help you manage that and make you feel more comfortable. But until this is gone and you're no longer counterbalancing that, the problem itself is never going to be solved. So if you're somebody that walks around with a great big belly and you can do anything to reduce that, it's in your best interest. Now, one other thing that we can do to help is strengthen the right muscles in and around your core, so that if you're going to carry excess weight, you had better be very strong so that the muscles can take up some of that strain. So if you need information on that, certainly let me know. And if you need information on losing that great big belly, also let me know. We do have a great weight loss program that's helped many, many people within our office to get down to a healthier weight, to not only be healthier, with blood pressure and heartburn and all sorts of other things, cholesterol and all these different things that it's helped them with, but it also makes their spine more comfortable. So if you need help with any of that, make sure and let me know.